This is VOA Africa.
Hello, I'm Esther Githui-Ewart. It's Monday, May 4th, and this is Africa 54. Due to the global outbreak of COVID-19, Voice of America is taking every necessary precaution to safeguard its employees. So our broadcast will look a little different today and in the near future as we, out of an abundance of caution, reduce our staffing at VOA headquarters here in Washington. We're working to help keep you informed about what's going on, and we appreciate you staying with us on Africa 54. We begin our broadcast with the global search for a COVID-19 vaccine, which the World Health Organization says currently involves about 90 different potential formulations in multiple countries. The WHO says those vaccines must be tested both for safety and to prove they are effective before doses can be manufactured for the public. Health officials are cautioning the process could take 12 to 18 months. But U.S. President Donald Trump on Sunday sounded more optimistic, saying he thinks there will be a vaccine by the end of this year. There are more than 3.5 million confirmed cases of COVID-19 worldwide, with nearly 250,000 deaths, but more than 1 million people have recovered from the disease. The United States continues to lead the world with more than 1.1 million cases and over 68,000 deaths, according to Johns Hopkins Coronavirus Resource Center. Turning to Africa, where Tanzanian President John Magufuli says coronavirus test kits in his country were dismissed as faulty because he says they returned positive results on samples taken from a goat and a pawpaw. Magufuli says the test kits had been imported from abroad. Ivory Coast Prime Minister Amadou Coulibaly is in France Monday for medical checks, according to a statement from the president's office. Coulibaly, 61, began self-isolation in late March because of possible exposure to the virus, but did not test positive at that time, according to Reuters. Ivory Coast has recorded more than 1,300 cases of the coronavirus and 15 deaths. Meanwhile, South Africa's mining union says it has won a court case against the government, forcing authorities to impose strict guidelines on mining companies to safely protect workers against COVID-19. Reuters says South Africa, the world's largest platinum, manganese, and chrome ore producer, has recorded over 6,300 cases of coronavirus and 123 have died. The United States Food and Drug Administration has granted emergency use authorization for a drug called Remdesivir to treat patients diagnosed with coronavirus. White House correspondent Patsy Widakuswara explains.
Remdesivir is an experimental broad-spectrum antiviral drug made by American pharmaceutical Gilead Sciences that was first developed to treat the Ebola virus. President Donald Trump announced the U.S. Food and Drug Administration has approved its emergency use to treat COVID-19.
It's really a very promising situation. We've been doing work with the teams at the FDA, NIH, and Gilead for spearheading this public-private partnership to make this happen very quickly.
Preliminary studies showed Remdesivir can help patients recover 4 days faster on average. Former FDA Associate Commissioner Peter Pitts.
So it is not a game changer, but it is extremely important for a number of reasons. Firstly, it shows that we can, in fact, impact the course of the disease for those who are most at risk. And secondly, it will allow us to better allocate our resources for hospitals, hospital beds, gowns, masks, doctors, nurses, healthcare technicians, so that we can protect those most at risk.
CEO Daniel O'Day said Gilead Sciences is donating 1.5 million vials of the drug and would work with the federal government to distribute it to patients in need. The FDA previously authorized emergency use of the malaria drug hydroxychloroquine to fight the COVID-19 virus, then issued a warning against taking it outside of a hospital or clinical trial after reports of serious heart rhythm problems in patients. Without other proven treatments, healthcare workers will likely be considering Remdesivir, particularly for patients who are severely ill.
Remdesivir and its emergency use authorization is not a signal for the 85% of COVID-19 patients who can, in fact, ride the disease out at home, in bed, resting, plenty of fluids. This is for a desperately ill population, and that's why the EUA was issued, because these people really need help and they need it right now.
Other big news from the White House Friday, the return of briefings by the press secretary.
I will never lie to you. You have my word on that. As to the timing of the briefings, we do plan to do them. I will announce timing of that forthcoming, but we do plan to continue these.
Patsy Widakuswara, VOA News.
Researchers throughout the world are searching for remedies to treat COVID-19, the disease caused by coronavirus. There are some drugs that show promise, but fears among the public can lead to searches for unproven therapies. Here is VOA's Carol Pearson.
A drug called chloroquine, and some people would add to it hydroxychloroquine.
In mid-March, President Trump touted drugs used to treat malaria as a remedy for COVID-19.
Based on what I see, it could be a game changer.
And even though there was no proof that it worked for patients stricken by the virus, the president continued to promote the drugs.
I've seen people that are going to die without it. And you know the expression, when that's happening, they should do it. What really do we have to lose?
They can be potentially cardiotoxic at very high doses. And for people with pre-existing conditions, there are additional risks that come along with these two drugs. And so they should be taken under medical supervision.
A new study published in JAMA Internal Medicine found that internet searches by people who wanted to buy these drugs jumped by nearly 1,400% after President Trump recommended them.
Instead of just looking at search trends that were indicative of people just Googling and kind of learning more about these drugs, we specifically looked at people seeking out to buy or order these drugs in addition to kind of using these terms in addition to these e-commerce websites.
Disinfectants are hard to find in stores, but calls to the CDC, poison control centers, and state departments of health increased after Mr. Trump said that injecting disinfectants might also work to treat COVID-19. Both manufacturers and doctors warned the public not to try it.
Introducing one of these products in any way, shape, or form, be it by injection, ingestion, or application on the skin, is harming the body.
What the study suggests is that statements from political leaders influence people's actions, and misinformation can have harmful or even deadly results. Carol Pearson, VOA News, Washington.
The Kenya government has rolled out mass testing for COVID-19 in some parts of Nairobi, which is being particularly struck by the virus. The Kenya Medical Association is boosting its capacity to train all healthcare workers in the front lines of fighting the disease. Africa 54's Paul Ndiho spoke to Dr. Jacqueline Kitulu, president of the Kenya Medical Association, about what they're doing to help curb the spread of the virus.
Dr. Jacqueline Kitulu, welcome to Africa 54. How are you?
I am very fine, thank you, Paul. Thank you for inviting me to your show.
Bring me up to speed. What is it that your umbrella organization, the Kenya Medical Workers Association, is doing to fight COVID?
Our mission, it's actually a twin mission, which is doctors' welfare and championing for quality healthcare to the public. So in those two areas, of course, our mission cuts out what we are doing in the context of COVID. We are at the forefront. We are sitting on the Ministry of Health COVID Task Force Response. We are sitting in the case management, in training, communication, as well as represented in the National Coordination Center for Quarantine and Isolation Facilities. If we are the foot soldiers, then we need to adequately train our foot soldiers. So one major area we have taken part in is in the training. And what we have done is actually to ensure that that training can be availed online. We are training healthcare workers at different levels in different parts and using our branches. That's part of what we are doing to disseminate the training. Part of the technical teams offering the professional advice in terms of certain decisions that are being made.
Wondering what the Kenyan government has done and to what extent has the organization that you lead maybe been at the forefront of making sure that the people you lead stay safe, the doctors you deal with are safe?
So our advocacy really to the Ministry of Health has been in terms of the need to recruit adequate human resources for health. Not only doctors, but we are looking at the whole healthcare workforce, the nurses, the radiologists, laboratory technologists, even just in the area of testing, that you need inadequate technologies to take samples, to run samples. In the hospitals where we've had even any cases at all, and healthcare workers have been exposed, there's one particular hospital actually which had to put into quarantine 40 of their staff. Wow. You can imagine what that does to the functions of that hospital when you put 40 people in quarantine. Advocating to healthcare workers that do not put yourself in any dangerous situation. You must have the appropriate adequate PPE. So that is, we are pushing the government to ensure that there is adequate PPE. And that will ensure that, therefore, as healthcare workers, we are not only responding to COVID, but we can also deal with all the other issues. There are chronic illnesses, there are other acute illnesses, which would suffer if healthcare workers fear to go and deal with patients because they feel they're not adequately protected.
There is a lot of emphasis even here in the United States about testing. A lot of people are going to know that they're actually sick or they have contracted COVID-19. Is the Kenyan government or the facilities in Kenya are able to test people?
Okay, so indeed our strategy even as a country is test, isolate, treat. So testing is critical. Indeed, you can't fight an enemy who you can't see. Now, the challenges around testing have been, of course, around testing kits, the availability or lack thereof, the sample collection kits. In fact, now the greatest challenge we've had is the nasopharyngeal swab. But in terms of capability as a country, that is very clear. We do have the capability. So in essence, and the machinery is there in terms of the equipment needed, the expertise in the labs is there, and especially with the automated systems, those are available. So if we can have enough kits and enough sample collecting kits, I think we can move to a level of testing at maybe not mass testing, because the numbers that you require for it technically to be defined as mass testing, maybe those are excessive numbers. But yes, in terms of a wider mode of testing, I think that we can go in.
The social distancing guidelines in Kenya, how has it impacted people, and how is it effective? Can it really work in the context of Africans being very sociable people?
The challenge is there because indeed you have people, maybe 5-6 people living in a 2-room house. How much social distancing can you do there? But in terms of the distance therein lies our major challenge. How much can you, the socialization or even the infrastructure, the sort of dwellings we have in certain areas don't allow for social distancing.
I have to commend you for being out there on the front lines, doing the very best to save lives. For that, I have the highest respect for all the doctors on the front lines. And thank you so much for your time.
Thank you.
An escalating war of words between the United States and China over the origins of the COVID-19 pandemic caused mostly lower trading in Asian markets Monday. Hong Kong's Hang Seng Index lost a whopping 4%, and the Korea Composite Stock Price Index in Seoul was down more than 2.5%, while the index in Sydney enjoyed gains of almost 1.5%. The markets in Japan, China, and Thailand were closed for holidays. China has dismissed the possibility that the coronavirus pandemic originated in a Wuhan lab and that it was not transmitted from animals to humans in Wuhan as commonly believed. We're excited to hear what you think about Africa 54 and the stories we cover. Join the discussion on Facebook. The address is Africa 54. We're also streaming our broadcast live on Facebook. Please watch and share our show with your friends. Also check out our headlines 24/7 on voaafrica.com. Still to come, coronavirus hits sports where it hurts most. We'll be right back after this break.
Hi, you just hi. Nina ukani luka buseni, ngachimweo kapena ni malaria. Zambia.
Welcome back to Africa 54. What is it like to be at the epicenter of an emergency room during COVID-19? How do medical professionals deal with what they see and who they cannot save? Are their families falling apart? VOA's Caroline Presutti speaks with two doctors who describe what really happens in the hotspots.
This is Mike Wilson at home. This is Dr. Wilson at work. In Texas, he and his wife care for their 7 children. In New York City, he cares for hundreds of patients.
This is like our Super Bowl, if I had to say. You know, we spend a lot of time in our career taking care of, you know, maybe some runny noses and sprained ankles and that kind of stuff. But this is the thing that we really train to do.
So when he saw coronavirus videos like these, he knew he had to fly to New York to be on the front lines.
And I wanted my children to know that when whatever it is in their lifetime, that no matter what your politics are, what your religious beliefs are, or whatever, when the balloon goes up and the nation issues a call to help, you don't just sit there.
Wilson helped build his hospital from scratch. It's a bit unsettling for patients who enter a New York field hospital assembled inside a ship, a convention center, or sports stadium. But Wilson also had to adapt when his first 25 patients spoke 5 different languages.
I mean, these are people from the near and the far east. They are dialects of, Muslim countries that I've never even heard of. So just such a vast, rich culture.
He says doctors now better understand the path of the virus, with the crucial time being its 5th to 8th day. Dr. Wilson agrees the curve is flattening, but he worries that big cities may open too soon, and a second wave of sickness will shut down the country again.
The medical surgical floors are still full of patients who are on ventilators. Like there's nobody without a tube in their throat there. The cafeterias are still, housing patients. The ERs aren't full anymore, and the waiting rooms are probably desolate. But there's still the infrastructure up in the hospital is still on, to some degree, itself is on life support. Like they can't function as a hospital right now. They're nothing but a COVID center.
Hang in there, and we love you, and we're praying for you. And this is Ernie. He says hi too.
Video care packages sent from home keep him strong.
Thank you, Mike. Thank you, Mike.
Wilson is in his 4th week of 14-hour shifts without a single day off. He keeps grounded by participating in family routines from his hotel room, not knowing when he'll see his home again.
I FaceTime with the babies. We do, story time. I spend some time with the older kids in the evening. We'll read our scriptures. We say our family prayers. And then once they go to bed, before I go to bed, I spend some time with my wife.
What does Dr. Wilson miss the most? Human touch. He has not touched another human being without a glove on for 24 days. Caroline Presutti, VOA News.
As World Press Freedom Day was being marked Sunday, Somali journalists are accusing the government of cracking down on press freedom with beatings, detentions, and threats of prosecution. Mohammed Sheikh Noor in Mogadishu takes a look at what it's like to be a reporter in Somalia.
Somali police detained journalist Abdishakur Shasha this year after he reported on a land dispute involving a senior government official. He says police also kicked him out of Johor City, but not before raiding his FM radio station and seizing his equipment.
I was raided by 12 heavily armed government troops in an armoured vehicle. I was also jailed 6 times prior to this attack.
Head of the Federation of Somali Journalists, Mohammed Ibrahim, says reporters routinely face official intimidation detentions and beatings.
Every week we document grievances from a number of journalists who were unlawfully treated or even detained by the police. Open-ended detentions of journalists are on the rise lately.
Somalia's National Intelligence and Security Service in April threatened VOA Somali service reporter Harun Maruf with legal action for alleged links to an unspecified threat to national security. The U.S. Embassy in Mogadishu tweeted the attacks threatened press freedom and independent media. But Somalia's Deputy Information Minister Adam Isaaq denied any crackdown on journalists or restrictions on press freedom.
I believe that our country is much better than many countries when it comes to freedom of the press, and that is evident in how our privately owned media, such as television and radio stations, are freely reporting without the government's interference.
The Committee to Protect Journalists ranks Somalia as one of the most dangerous places for reporters, with 69 killed since 1992. Mohamed Shaghnour for VOA News, Mogadishu.
I'm Amanda Bennett, and I'm director of Voice of America, and I'm talking to you from my home where, like most of you, I'm quarantined because of the spread of the coronavirus. The coronavirus is one event that shows us more than ever why a free press matters. There's so much bad information, so much misinformation, so much disinformation that people all around the world are depending on us to give them factual information. And because of that, we are also depending on all the brave journalists all around the world who, perhaps in places that don't enjoy a free press, are still continuing to report on the truth about coronavirus in their country.
Amid the fight against COVID-19, U.S. President Donald Trump and presidential candidate Joe Biden are planning how to campaign leading up to the November election. Each man faces challenges that need to be overcome in order to win the presidency. VOA's Elizabeth Lee explains.
Amid protests and pressures to open the economy, even when infections and deaths from COVID-19 continue, more states are slowly reopening businesses.
It is a balancing thing. We got to bring the economy back, but we also have to continue to protect people.
For the first time in weeks, U.S. President Donald Trump announces plans to travel to Arizona and Ohio, two states important to Trump in the presidential election. This comes at a time when presidential candidate Joe Biden is ahead of Trump in the polls in numerous battleground states.
The disinfectant.
Trump's handling of the COVID-19 crisis, especially some of his past comments during press briefings, have drawn controversy.
Who can you trust to dig us out of this mess? This president has been chronically inept at handling this coronavirus.
The Republicans are focused on the president's track record with the economy.
Voters approve of the president's handling of the economy heading into this pandemic, and they recognize that he's going to be the leader to restore the economy coming out of this.
As the Trump campaign works to improve his poll numbers, Biden is also facing a challenge. A former employee of Biden's Senate office is accusing him of a sexual assault that happened almost 30 years ago, which Biden has denied.
This did not happen. He was forceful in that.
Then there's still the hurdle of the pandemic both campaigns have to overcome in a time of social distancing. The question is when large gatherings of people like this one can happen again.
We are not going to put voters in harm's way. We won't do that until it is appropriate to do so.
I hope that we're going to be able to do some good old-fashioned 25,000-person rallies where everyone's going wild because they love our country.
For now, that is still a hope, as each candidate continues to campaign electronically in the virtual world. Elizabeth Lee, VOA News.
In our sports segment, professional sports is suffering as a result of the coronavirus pandemic. International championships are being cancelled, leading to major financial losses for team owners and organizers. But professional athletes are also suffering. Maxim Moskalkov explains.
The coronavirus pandemic and the strict quarantine measures taken by dozens of countries have led to the cancellation and postponement of a myriad of sporting events around the globe. Even the 2020 Summer Olympics in Japan have been pushed back a year. Many sports organizations have suffered enormous financial losses. USA Rugby even filed for bankruptcy, unable to cope with the financial toll of the COVID-19 spread.
Then to have athletes that are simply locked in their houses, not able to train, not able to use public facilities.
For professional tennis player Alla Kudryavtseva, 2020 was supposed to be a big year. She was planning to come back to professional sports after a maternity leave. However, in March, after a series of big tennis tournaments, including Wimbledon, were cancelled, she realized things are very different now. So instead of touring the world, she's staying at home in Boston with her husband and baby daughter.
I'm trying to take this time and just focus on getting physically better. I'm trying not to stress too much about not playing tennis. I'm trying to stay calm and hope for better things to come and to be even better prepared when the situation presents itself.
Professional volleyball player Josiah Byers had to come home to California after a big championship in Greece was cancelled. Now he has next to no chance to properly train.
Like the apartment complex that I'm in, like the gym is closed. So, we don't have that much access to, certain weight trainings that we normally would have in other places. So we have to kind of make our own workouts at home. People who dedicated so much time into their sports, like suddenly just have to stop. And, some people, it was like their last year and now they can't finish it. And so.
However, a lot of sportsmen and women believe the pandemic is not a reason to feel depressed. Famous football players, tennis players, and field athletes start online flash mobs to get in touch with their fans, share their workout routines, and do charity work.
We're sportsmen. We have responsibilities to you because you support us. And now is the time when we cannot fail you. Together with Pau Gasol, we're launching an initiative that will unite all professional athletes and help the Red Cross. Our goal is to raise 11 million euro to help those who suffered from the crisis.
And if the competitive mentality has taught professional athletes anything, they say it's the knowledge that there are no obstacles, just challenges, and that the world will get through it. Maxim Moskalko for VOA News, Washington.
And that's our show for today. Be sure to watch Africa 54 on our website at voaafrica.com. From all of us here in Washington, thanks for watching.